My name is Dr. Bob Domalewski. I am the past president of the Denver Catholic Medical Association, and we have a new president we're going to introduce tonight. We have two speakers tonight, Jenny Kraska, who's going to be talking about the implementation of the physician-assisted suicide bill, and Father Tim, who will be giving us some spiritual direction. He is our new chaplain. I'd like to get the meeting started simply with a prayer. Simple Our Father, if we could get going. In the name of the Father, and the Son, and the Holy Spirit. Amen. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. Amen. I'd like to introduce Dr. Maria Gove, who had been past president of the Dallas, Texas Guild for about a year. Were you president? And she has agreed to take over the responsibilities of president, which is sort of a tough, luckless job sometimes, but nonetheless, we're grateful to have you here. If you could come forward and just introduce yourself, tell us a little bit about yourself and some of the plans we have for the upcoming National CMA meeting, which will be here in Denver in September.
My name is Maria Gove. I'm an internist. I did internal medicine and pediatrics in training, but I've only been practicing internal medicine for the past 10 years. We moved here from Dallas in 2015. In Dallas, I was part of the group that helped found the guild there. And so I was president, but we kind of all just worked on it together. And so I was part of that for about 4 or 5 years. And then we moved here in 2015, and so I'm excited to help out. I didn't realize I was going to be president, but that's okay. I thought Michelle just asked me to help out with the board, but that's great. I also have an ethics background, so I was on an advisory board of the bishop in Dallas, and for ethics questions that would come up from parishioners and from priests at different parishes. And so if I'm interested in that, if that's necessary or requested here. And then we were also hoping to get some ethics discussions on the agenda, so that's going to be kind of looking forward, and we'll listen to your feedback. I work with Mike at the Denver VA, and I will be moving on to Kaiser in the summer. So I'm going to turn it over to Jenny.
So thank you for all the help you've given me. As most of you know, physician-assisted suicide has become legal in Colorado after the November elections and the vote in favor of physician-assisted suicide. Tonight, I'm basically just here to talk a little bit about what that means, how the implementation process is going, what has been happening, and maybe to answer a little bit of your questions, if you have any in regards to legislation that might come up around this issue and just how the implementation is rolling out. What I can tell you is that the implementation is not going well, and that is from the perspective of Compassion and Choices. They recently went on Colorado Public Radio and did an interview, it was only about 2 weeks ago, and they said that they were very unhappy with how implementation is rolling out because they did not expect that so many healthcare providers and facilities would choose to opt out of providing physician-assisted suicide. So if there is a silver lining in all of this, I guess that would be it. Over 1/3 of all facilities in Colorado have opted out already of providing assisted suicide, and those are not just faith-based facilities. Denver Health is probably the largest non-faith-based facility that has chosen to opt out of providing physician-assisted suicide at their location. So, but what that means in all actuality is that they will tell patients that there are other facilities or other doctors that they can find, and they can direct them to those facilities. But that is technically what the opt-out means for Colorado. And so, go ahead.
So just follow up on that.
Yeah.
My understanding was that they opted out for now, but they are working on it. Is that what you understand? Like,
Right,
there's
so-
a group in Denver Health trying to
Yes.
locate funds.
So technically, they have filed their paperwork with the state, but yeah, that's not to be, just because you file the paperwork doesn't mean that you won't change that position at some time at a later date. And that's obviously something that any healthcare facility has the option to do at any point in time. One of the biggest reasons why many facilities might be considering, like Denver Health, maybe opting back in is Compassion and Choices in their interview with Colorado Public Radio stated that they plan to bring a lawsuit soon against facilities that are choosing to opt out, because they believe that the language in the ballot initiative did not mean that whole healthcare facilities or practices could opt out. They read the language and they meant the language to just mean individual doctors could opt out, not whole healthcare facilities or healthcare practices. And so right now, that's sort of the tension that has arisen with this law. Is Compassion Choices was the backer of this law. They, for all intents and purposes, wrote the law, and now they are unhappy with the implementation of the law and what it has come to mean in Colorado. Go ahead.
So what does that mean for Catholic hospitals if they force, I mean, can they try to force Catholic hospitals to opt in even though they have a religious conviction?
Yes. That's what the main thrust of the Colorado Public Radio interview was, to say that they were very unhappy with the religious institutions that had chosen to opt out. So they interviewed folks from the Sisters of Charity of Leavenworth Healthcare System, and then also some Centura folks as well, who have all chosen to opt. Choices is saying is that they believe that they have grounds for a lawsuit to bring against either Centura, Sisters of Charity, both, and all of these institutions, to say the intent of the law in their eyes was not to opt out whole facilities, but to just opt out individual doctors. So what they're going to try to do via a lawsuit or via legislation, they have not ruled out legislation, is to say the opt-out provision did not, we need to clarify the opt-out provision and what that means. So whether that's done via a lawsuit or legislation, if I were advising somebody, I would say you might as well try legislation, because it's a much cheaper route to go than getting lawyers involved in a lawsuit. But I would assume that at this point in time, we haven't seen legislation brought up yet, but it wouldn't surprise me if we see a bill at some point between now and the end of session.
I think Compassion and Choices is really upset because under normal circumstances in Oregon, Washington, these other states, if a hospital says, I'm not going to, we're opting out in the hospital of dispensing and providing assisted suicide medications, it's so rare, if ever, that it's actually done in the hospital.
Right.
It's usually in the home. But I think when these institutions decided to opt out, they included all their employees
Exactly.
and physicians. And so that's giving them a bad name that say that they can't do that. And I'm sure there'll be some physicians that would say, I want to be able to do this.
Right.
Even though I'm an employee of Centura or whatever.
Exactly.
But when you look at Oregon, I think out of 5,600 physicians or 6,000 or something like that, only about 105 prescribe, or maybe 200. So
Yeah.
they have nothing to worry about. They're going to be able to dispense their poison. Right?
Yeah.
One of them prescribed 12.4% of all the prescriptions.
Right.
Right.
One person.
Jenny, so actually, I wonder if there could be sort of a reverse mechanism here. If an institution, say a religious institution, is forced into opting in, but I'm thinking particularly of Catholic institutions, when you sign on to be a staff member at St. Joe's Hospital or St. Anthony's, you sign on and say, I will abide by the Catholic ethical and religious directives. So so even though an institution may be forced to do it, if you are a physician staff member or an employee of the institution and you sign and say, I will follow the Catholic ethical and religious directives, which it includes, against physician-assisted suicide, it's sort of a dead horse, because you can force the institution to do it, but if you can't be a part of the medical staff or an employee because you've already said I'm following the ethical and religious directives, it's sort of a non-event. I mean, so what?
Right, no, exactly. I mean, I think they're going to have a hard time. I think that's one of the reasons why we haven't seen them jump right away to a lawsuit. One, I think the rollout is taking a lot longer than they thought it would take. My understanding is Compassionate Choices really thought that this would be almost a simultaneous type of thing. It would pass in November, and right away the new rules and regulations would be written, and they would be dispensing within weeks of when this passed. That has not happened yet because they are going through rulemaking processes. There is licensure issues to be concerned about, that they're making new rules around for medical licensees. And things like that. So it's going much slower than they anticipated, and they are really not happy with the amount of people that have already opted out of providing this. And so it was, I think, a little bit of a shock to them to see that this was how the rollout happened, because they truly believed, given they thought they were on a roll in the sense of California had passed their law, Colorado was next, who are we going to move on to next? And with the pace that it is happening bureaucratically in Colorado, it's taking a lot longer than they anticipated, and it's not going as well as they thought. The other interesting note to all of this for you that are interested is, while this is all going on, there's still another group that is trying to get another ballot initiative brought into the process that would actually change. So this ballot initiative that was passed, Proposition 106, changed our state statutes. So technically, the good thing about that happening is that technically, if the legislative dynamic changed in Colorado, if we had legislators on either side of the aisle who were more willing to do something about this issue, we could actually change physician-assisted suicide in Colorado with a piece of legislation in the legislature. There is a group that is trying to get a ballot initiative run that would legalize physician-assisted suicide in our state constitution, which means that once it's put into our constitution, the only way it could change is by another constitutional ballot initiative. So I just throw that out there as something to kind of, so far it has not gone very far. My hope would be that the money would not be there for them to run something like this, given that this was just ran in the last election cycle. But I throw that out there as something for you to be cognizant of. If you hear something about this, it is a real thing. It is happening potentially again. That we would see, the next time we could see a ballot initiative like this potentially is 2018 in Colorado. And so I just throw that out there as something to sort of keep in the back of your mind, that this is something that there are groups that are very unhappy with the fact that this was not put in our state constitution and just in statute. So they're trying to make it more permanent by putting it in our constitution.
Is Compassionate Choice supporting them financially?
No, they are not. And that's why I say it's probably not likely that they will get on the ballot, because without the money from Compassionate Choices, it's very difficult to pay people to go out and get signatures. Compassionate Choices put in close to $6 million in Colorado to get this on the ballot, between signature gathering, advertising, the folks that they paid to do all of their ads and things like that. So without that money, it would have been, it's extraordinarily difficult to go out and get the right number of signatures to get something on the ballot.
Judy, clarify this for me.
Yes.
Does the law give a directive to the institution or to the individual providers? I'm thinking about institutions like nursing homes, assisted living
Right.
facilities. What do those doctors
So
do?
it doesn't define. This is where there seems to be some leeway in the law, and this is why Compassionate Choices thinks that maybe filing a lawsuit or having legislation would be the right way to go. They say that healthcare facilities have the right to opt out, along with individual providers. The difficulty with all of that is that the term healthcare facility is not defined in the proposition, and so that is where the right, and so that is where the ambiguity is coming in, and they want to say that the intent of the law was that healthcare facility did not mean whole health institutions. It just meant individual doctors at particular facilities. So,
That's dubious though, because
Right.
a person's not a facility. So
Right.
you couldn't grammatically pass that in front of a second grader, okay?
right.
Facility does not equal person. I mean,
I will say, as a lawyer, stranger things have happened in courts of law across this country. So,
we have problems defining person.
yes.
Yeah, it just seems to me that they're just, they're kind of bratty kids who are upset and
Right.
want to take their ball and go home and leave in the morning.
Exactly.
Play.
No, that's exactly it. I don't think the lawsuit would go, I mean, my personal opinion is I don't know that it would go very far, a lawsuit, but it would obviously raise this issue again in a court of law, and then there would probably be legislators that would decide, wow, this term wasn't defined. Let's run legislation to define this and make sure that
You'd have to look at every law that says facility.
Right.
That would be a crazy, fiasco to try to look at every law that talks about a facility and what that means, let alone define healthcare facility.
Right.
So that to me seems, if I was in legislation, I'm like, sorry, you lost. That was your own dumb fault for the way you wrote your own law. So
Yeah.
too bad.
And unfortunately, again, courts are bad, but for those of us who have spent any time at the Colorado legislature, the legislature is even worse.
Yeah.
So it would not be beyond the pale for them to try and take this on.
Can you just clarify? So if you're talking about something being passed in legislation, that
Yes.
just means that the elected people in Congress are just voting themselves, right?
Correct.
To change the law. But if it's a ballot initiative, that means like citizens vote.
No, so in Colorado, there's two different types of ballot initiatives. One is statutory, which means that it only affects our state statutes. And that's what Proposition 106 was. So what Proposition 106 did is it added language to legalize physician-assisted suicide within our already existing state statutes.
But that has to be voted on by people rather than, citizens rather than just.
Both of them do, right. Both ballot kinds have to be voted on by the people, but the other type of ballot initiative is one that changes our state constitution.
It's harder to change it.
Right, and so the only way that our state constitution can ever be changed in Colorado is by a vote of the people on a ballot initiative. Statutes can be changed by the legislature.
Without involving citizens.
Right. So even though this was voted on by the citizens, it's now in our statute, which means it doesn't have to go back to the citizens, technically, to be voted on. So if we had a legislature that was amicable to our position, and a governor who would sign a law that would maybe undo physician-assisted suicide or put in stronger protections, we could change that just via the legislature. That's the hope at one point in time. I mean, our hope is that we get a legislature that's friendly enough on both sides of the House, the Senate, and the governorship, where we could, if we couldn't wholesale undo physician-assisted suicide, we could at least put in some really good protections and clarify, maybe put in better reporting requirements, at least kind of chip away at physician-assisted suicide a little bit in Colorado.
It's important to get the right people
Right.
in legislature.
Yeah, so with the current makeup of the legislature, they have a better ability to get this going, right?
No, not the legislature we're talking about is in Colorado, not at not in Washington, D.C.
Even Colorado, because is the makeup of the legislature in Colorado, isn't it more liberal?
Yes, so there's, the Democrats have a 7-seat majority in the House, the Republicans have a 1-seat majority in the Senate, and then Governor Hickenlooper is Democrat. And so given that makeup, it is not a favorable makeup for changing the physician-assisted suicide law right now. There just isn't a willingness
Right, but
to do that.
It's a more possibility that the compassion choices may be able to do what they want to do with the current makeup.
Yeah, no, so they couldn't either unless they got a Republican to switch sides in the Senate. So right now we're sort of at a stalemate. I mean, for all intensive purposes, compassion choices could probably pass something in the House and not it would be stopped in the Senate, and vice versa. I mean, we could probably run a bill in the Senate. This year we had many legislators approach us saying, is there something we can do? But it will not. We've already talked to leadership in the House, and they have said anything that comes to the House will be, for lack of a better term, dead on arrival. So,
Question also, is this affecting, can pharmacists opt out as far as this, filling the prescription?
yes, they can.
They can.
Mm-hmm. Yep, and so this evening I've brought with you just some of the material. There's not a lot of material out there yet in terms of resources there are some groups that are putting together sort of sessions for doctors and healthcare providers about this. around the state, kind of presenting both sides, what the implications are. The only really written material that I've been able to find that is out there is from the Colorado Hospital Association, and they've kind of given their membership an overview of what the law means for not only facilities, healthcare facilities, but also individual providers. And so I've provided that material up here, and then they've also provided free of charge to their members an opt-out policy for facilities, including individual practices. And so if that's something that you're interested in, I've made copies of that. Please feel free to use this to pass it on to folks. It's a nice legally sound sort of document in terms of providing information to patients, because that's probably one of the biggest items that they talk about is letting patients know that you might be seeing that you won't be providing this service, and making sure that that's documented and that you've provided that information to people that you're seeing in that respect. So again, those are just a couple of resources that I have for you this evening in terms of Colorado specific type of legislation. There are also a lot of other concerns in terms of even just pastoral concerns at the parish level, I think, that you might run into. I've been at a few different parishes already talking to Stephen ministers who are doing this, who are concerned about what they might encounter from a spiritual side of people who might be considering this. And so I would say even at the parish level, as you go back, not even within your own medical practices and in what you're doing from that perspective, but even at the parish level, I think that there will be a lot of, as this becomes implemented more so into Colorado and it becomes more prevalent. To the best of my knowledge, we do not yet have anybody who has received a prescription for physician-assisted suicide yet in Colorado, but as that becomes more prevalent, obviously it will be something that I think we will have to deal with even at a parish level. People that are facing this or thinking that this is a prospect for them. And so I would say even bringing it back to your parish is something, and talking to folks that might encounter that at a parish level would be important as well.
I think it would be important for us to continue the education, because Jenny and I spoke to a large group of Republicans about this, and many people are still unaware, just like with Obamacare, what the implications of this is, and the dangers and the ugliness of it, really.
Yeah.
And Compassionate Choices, if you go on their website, they will also have a lot of good information to understand where they're coming from and how effective they are in their propaganda. Because they have, just like that has an opt-out thing for hospitals and things like that, in the Colorado Hospital Association, it's a great website for it. If you go into the Colorado Compassionate Choices, they have all kinds of forms for doctors in their offices, for hospitals, and for other healthcare providers to be able to give to their patients, or for the patients to download and bring to their doctor and say, this is what I want. I mean, the day after the election, when it passed, I'm part of the St. Joe's Ethics Committee. They're already confronted with it on the oncology ward, with people asking and wanting assisted suicide. So everybody's really scrambling of how do you address that, especially if an institution has opted out. How can you legally, what do you do with it? You know, it's just like, I want an abortion. Well, are you complacent in being, or complicit in being, in recommending we'll go to Planned Parenthood, or I know a doctor that does prescribe assisted suicide and that type of thing. So Compassionate Choices is gloating over this. You should see their website, and they also went into a very nice explanation of the lessons they learned from Massachusetts, when it was narrowly defeated, and they said the lessons they learned from that is what they took and brought it to California and here, and now planning on bringing it elsewhere. I'm not sure if they were really backing the Washington, D.C.
Yeah, they are, and it looks like, unfortunately, in Washington, D.C., it's a little bit different because the city council votes on things, but then Congress ultimately has the final say on whether it becomes law. And there's a time limit right now on when Congress has to make a decision by tomorrow, and it looks like they will not vote on it. And so that's a very unfortunate, because Congress currently would have the power to undo the physician-assisted suicide law that was passed in DC. And it looks like, from everything that I'm hearing from folks in DC that are working on this, Congress will not act on this. So,
And the president would have to sign it by tomorrow.
right. And it does
Both
not,
houses.
right, and it doesn't look like it's going to happen. Go ahead.
I'm just curious about the timing of the implementation, because you said that the people that were in favor of this are very frustrated.
Yes.
It hasn't been. But my understanding of other states, when they implemented it, was there was a lag period, and it was actually kind of surprising that Colorado was immediately enforced. I think in Oregon, I understood there was like 3-month or 6-month period where, before it was officially law, and here there was no delay.
Yeah.
So why are they so?
Well, because technically there is a delay happening, because what the state came in and said is the state has to certify. So after ballot initiative is passed, the state has to certify everything, and then if there's any rules that need to be made, there has to be a rulemaking process that happens automatically as a part of a ballot initiative passing. And so what the state came in and said is, yes, we certify the results, this passed, it's going to become law. But before it can be implemented, we have to go through, they called an emergency rulemaking session of different entities within this state that would be affected by this and would have to make the rules. And that's what's taking longer than they thought. And so that's why they're frustrated by the process.
They have that Cinco-Barbital sitting on the shelf.
Right.
What are they going to do?
Yeah, and I would say I think the biggest misconception that we're hearing that I'm hearing amongst people that I'm talking to about this issue and its implementation is people still very much think that this is something that you go to the doctor and the doctor gives you one pill or one shot. Everything the question I get asked most often, even now that it's passed, is most people assume that this is something that a doctor will be doing to them. They very much think, most people are unaware, even people who have heard about this and voted against it, still come up and say, well, I thought that this was just my doctor's going to give me a shot when I go to the doctor's and I'll die. And they don't understand what the process is. So I think that that's something else that you might, as providers, run into. Most people think that it is a sort of either a one pill solution or a one shot solution, and they don't understand what the actual mechanism is by which they have to take all of these pills and the actual process of dying. So that's something to be aware of as well.
Do you have to individually file papers if your institution opted in but you want to opt out, or how does that actually work?
So my understanding of how the law is written is that you have to actually, you don't have to provide official paperwork to the state as an individual, but you do have to let all patients know with some kind of paperwork that you won't be in writing, you have to, if a patient asks you,
So
and
you have to have your own paper. Is there like a special form? One of these forms
one of these forms can be adopted, and CHA also has other sample policies on their website.
You
So
basically have to just get, if someone asks you, have a form that you filled out.
yeah, from a legal perspective, and I believe from a malpractice, and I don't practice in the area of malpractice, so I don't want to give you false information, but I believe that you have to provide them written proof that you're opting out, like some sort of written documentation.
Just tell them and write your note, right?
Yeah,
You
and
don't have to tell them until they ask.
right. That's my understanding, is that from how
It has to be.
it's not something you would just tell every patient that walks in the door. It would only be patients. My understanding is patients who request it in terms of how the law is written. Now, again, it could be interpreted. This is where I think the lawsuits are there's a potential for lawsuits, is that it could be interpreted very differently by somebody who comes in and decides, I didn't know and I really wanted this drug and I'm going to go and try and sue my doctor now. I mean, that's something I think that could definitely happen, but
You have to ask.
right, exactly. But yeah.
Do you think it might be a good proactive way of like maybe putting it as for the new patient, paperwork, that we don't do this? Just like I know Dr. Ansari does this in his practice. We do not prescribe for contraceptives. We do not, just put add that as well. We
Yeah.
cannot-
I think that would be a great idea. I'm from a legal perspective, if you're already providing other services that you don't provide, this would be another thing to add to that. They could contact me. My email address is jcrasca@cocatholicconference.org. Please call me anytime. Email me if you have questions. And I would also invite all of you, if you're interested, ever to come up to the legislature, see how things work. Tom is a frequent guest up at the legislature, but it is a very interesting process to see if you've never actually, Alan's testified before as well, so please, if you haven't, come and testify. Well, if there aren't any other questions, I will thank you for inviting me to come and speak this evening. And there are a lot of, please know that you are in my prayers, because there are a lot of issues that are coming up in medicine and facing Catholic healthcare providers that I know. One of the other issues that we're dealing with currently with the talk of legislation that I hope you'll address at one of your meetings if you haven't is transgender healthcare and Catholic health. And I know that's a big, Colorado will probably see a big push on that issue sometime in the very near future. So thank you for everything that you all do. And